everybody, this is Karen Herbst from Total Lipedema Care. Today I wanted to talk to you about things that you can do to prepare yourself for lipedema reduction surgery and things that you should be doing after so that you can have the best outcome. You need to find a therapist in your area, preferably one that is LANA certified in manual lymphatic drainage therapy, who knows the lymphatic system, and who has been trained in not only lipedema, but lymphedema. If you find a good therapist, you really want to see them before you have surgery, so that after you have your surgery, they know you, they've seen you, they've taken notes on you, and they can refer to those notes and see what has changed. The most important reason why you're working with a therapist is because the #1 complication of liposuction is fibrosis, where extracellular matrix proteins deposit in the tissue outside of cells. The fiber structure of the tissue can become thick and very fibrotic itself. So you get proteins that are depositing in between cells, and you've got thickening and tightening of fibers in the tissue. So flow is very poor in lipedema tissue. Work with your therapist to decrease as much of that fibrotic tissue so that when the surgeon treats the tissue using a cannula, that cannula moves easy through the tissue and doesn't get stopped by additional fibrosis. There's all sorts of different things you can do to reduce fibrosis. Manual lymphatic drainage therapy, also deeper treatments into the tissue, instruments such as A-stim or Graston, also even just a simple gua sha tool. Will this be painful? Yes, but you can work with your therapist to reduce pain down to a minimum. They should be working through your tissue in layers, be treating lightly at first and going deeper into the tissue as you tolerate. Eating a healthy diet would be helpful to reduce inflammation so that your body is not making more fibrosis. The diet can be any kind, at least whole foods, low processed carbs, and one that you can sustain. Lots of other therapies that you could consider, such as red light therapy, cold laser, and just a plethora of others. Make sure that you have at least one therapist, if not a team, that are going to help you get the best outcome after surgery. Finally, you need to have compression garments. If it's difficult for you to wear compression garments, you should start slow. You could wear a pair of knee-high socks, bike shorts, an arm shrug. One piece of compression that kind of gets you used to it, and over time, perhaps you can add more and more pieces or larger pieces so that when you have the surgery, you and compression are best friends. So I wish you the best of luck in your lipedema reduction surgery. This is Karen Herbst from Total Lipedema Care.